Hello, my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. It is September 2017. This, of course, means that we are in the middle of our IC Awareness Month campaign, but I wanted to take a moment and raise awareness for another medical condition, uterine cancer, because earlier this year I had a terrifying uterine cancer scare, and I want to make sure that our members do not go through what I went through. It is not for the faint of heart. So about a year ago, I started spotting. Now, I haven't had a period in about 2 years, and it was the palest pink of blushes. And I noticed it on my mini pad. Really didn't even pay attention. I mean, I noticed it, but it didn't seem like a big deal. And so over time, September and October, it started to get a little bit more intense. And then in November, it transitioned into small drops of bright red blood. Now, I called my OBGYN and said, hey, I've started spotting. What do you want me to do? He said, well, I want you to get in here right away. Let's do a biopsy. And I made a really stupid mistake. I let fear stop me. I didn't do it. I waited. And so from November through the first couple of weeks to December, the spotting got worse and worse until finally I was passing blood clots. And the Friday before Christmas, I got into my OBGYN for an urgent appointment because I honestly was quite scared. Now, I expected to have a biopsy at that moment, but what he did instead is we measured the layer of my endometrium to see how thick it was. Normal is 4 millimeters. Cancer is usually 12 millimeters. Mine measured out at 6 millimeters. And he was not that concerned. He said, you know, Jill, you're on estrogen. This is kind of what we would expect on estrogen. So let's go ahead and try to force a period. So from January through March, that's what we did. We played with my hormones to try to force that period and try to reduce the thickness of that coating. And I was all in for that because it meant that I didn't have to have a biopsy, and I was a little afraid to have a biopsy. I was afraid of the pain that it would cause. So I go back in April, and we measured my endometrium again, and we were stunned that instead of being thinner, it was thicker. It had grown to 8 millimeters. This was an immediate warning sign that something not good was going on. And so my doctor absolutely said, we have to do a biopsy now. So I had what is called a hysteroscopy. That's done in the office, and where they gently numb your cervix, open it up a little bit so they can pull out a sample. And it wasn't that bad. I mean, you know, it's not the funnest thing in the world, but it's not as bad as having a cystoscopy in the office. So we have to compare bladder treatments and this. It was a piece of cake. And I just had to wait. I had to wait for 7 to 10 days for my biopsy results. Those came back much more concerning. What the biopsy found was that I had complex endometrial hyperplasia. So that means the normally simple cells of the endometrial layer had become complex. They had started to grow. And then I also had what was suggestive of a polyp. So the doctor kind of put his foot down and said, you know, we don't have a choice. We have to look at your entire uterus through a DNC. Now, a DNC is an outpatient procedure done in the hospital. And my memory of a DNC was when I was in 7th grade, and I had to go into the hospital outpatient center for a hydrodistension for my bladder. And I remember waking up to a woman in the bed next to me crying because she had had a DNC and it was very painful for her. So 40 years later, I remembered that. And I was very, very worried that having a DNC would aggravate my bladder. It didn't, thank God, but that doesn't mean that I wasn't scared. So a couple weeks later, I went into the OR, and they did, I have to say, you know, my biggest concern, aside from what it could do to my IC, was I just wanted to be able to urinate afterwards. I had had another procedure where I hadn't been able to urinate for 8 hours. I mean, years and years ago. And so I showed up at the hospital, and my sister took me. Thank God for my sister. She's an angel. And you go into outpatient, they pull you in and you change your clothes, and then they do your assessment. You meet a nurse. She's really wonderful. And then you meet the anesthesiologist. And again, I reiterated my point. I want to be able to urinate afterwards. And he said, no problem. And what they did is they used a different anesthetic. They used propofol. You may know propofol because that is what Michael Jackson overdosed on, because of course he was taking way, way, way too much in an unsupervised or a poorly supervised situation. When it's done in an outpatient procedure, they can use a very, very small amount, and by golly, it worked, and it worked beautifully. So my DNC probably lasted 45 minutes. And I woke up in the recovery room, and the doctor said, okay, well, we didn't find anything massive other than a polyp. And in fact, I have a picture of it. I had him take lots and lots of pictures. So you can see that is the polyp that they found. So they pulled the polyp out, and let's see, I have another picture. That is the picture of the area with the polyp gone. They just cut it out entirely, and sent that off for biopsy. And of course, I was sent home, thankfully, with pain medication. I was really clear with them. I did not want this to exacerbate my pelvic pain, and I stood my ground. I said, I will not do any procedure without opiate pain medicine. And thankfully, he was absolutely accommodating and said, not a problem. You will definitely have Norco. And thank God, because it worked, and it worked really, really well. So then I had to wait again, and he told me it would take about 7 days, and 2 weeks later, still no answer. And finally, about 20 days later, I emailed him and said, so what's going on with my biopsy? And he took a breath and said, well, we just got your results back from Stanford, where we sent them for a second opinion. Which point in time I took a breath, because that's never a good sign. I always say that good news travels by email, bad news travels by voice, and he was talking to me. And he said, we have found complex endometrial hyperplasia with atypia. Now, atypia are the cells that turn into cancer. And then the Stanford pathology department found also a, quote, vague architectural complex. Now, what that means is that it was starting to build something, tumors, something. So he said, the good news is we don't see active cancer right now, but we see the signs of what could be cancer. But what we can't do is guarantee that you don't have active cancer in your uterus itself. And he put the hammer down and said, you have to have a hysterectomy, and you have to have it now. It's an emergency. I can't even begin to say how scared I was. I wasn't scared for my uterus because I can't have children anymore. What I was the most scared of was what it would do to my IC, because a hysterectomy, I've worked with hysterectomy patients for years. I know how painful the recovery can be, and I know that some patients have struggled. And I was deeply concerned that it would put me back 20 years back to when my IC was really, really bad. And I can't even begin to tell you how scared I was. It was bad. But, your life is at stake. And we scheduled the surgery. I couldn't believe it. I went from being in control to being completely out of control. Completely out of control. he wanted me to go see an oncologist in Sacramento. I'm in Santa Rosa, California, and have my surgery over there so that they could do a biopsy during the surgery. And I couldn't imagine driving that far and then driving home because, believe it or not, a hysterectomy is an outpatient procedure. And so I asked if we could do it at home, and he said yes. He talked with the oncologist and said, yes, we can do that as long as you understand that if we find active cancer, you will still go to Sacramento this summer and you will still have another surgery to pull lymph nodes. So, May 23rd, 2017, I had a total hysterectomy. I lost everything. My ovaries, my fallopian tubes, my uterus, and my cervix. And the surgical procedure was the first challenge. We had to decide how it was going to be done. Was it going to be a Da Vinci robotic procedure, or was it going to be a laparoscopic assisted procedure? Both involve incisions in the belly to look at your pelvis, and they're minimally invasive, so their recovery time is much, much easier. So I had a laparoscopic assisted vaginal hysterectomy. I have 5 incisions, 4, I would show them to you. I mean, honestly, I really, really would, but I won't. I have 4 incisions on my belly, and then 1 large one at the top of my cervix. I mean, at the top of my vagina where my cervix was. And they basically just detached everything, and then they pulled it out in one piece through my vagina. Like, really? It's surreal. It's still, I mean, it's only 3.5 months behind me, and I'm still in shock by the whole thing. So I was home 5 hours later. It's like, really? How can they send you home so quickly? 5 hours later. Now, they have a lot of warnings, and that is, like I had 2 rows of stitches. I had a shallow row of stitches at my vagina, and then I had a much deeper, a thicker, coarser row of stitches above that, which basically held my viscera together. And so you can't lift anything. This involves your core, and so anybody with a hysterectomy, you can't lift anything for months. Because if you do, you can tear a stitch. And I tore a stitch about a month afterwards in my bedroom, bending over to pick up a t-shirt. And I walked into the bathroom and I was just soaked with blood. So they're not kidding when they say you can't lift stuff. The second issue, of course, was managing pain. This is big surgery. And the pain was thankfully controlled with Norco. They didn't hesitate to give me pain medicine. The first day I used half of a 5 milligram pill. So I took a 2.5 milligram pill every 2 hours for a good 36 hours. And then I slowly went to 4 hours, and then I went to 6 hours. And I didn't need daily pain medicine within about 10 days. So then we had to wait for the biopsy results. And it was really scary. But the biopsy results came back in my favor. They did not find active cancer. All they found were these atypia cells throughout my uterus. And it was absolutely the right decision to make. No doubt about it. I mean, I had already been spotting. I had already been bleeding. So there was no doubt about it that I needed it. But the physical recovery was challenging. In fact, I closed my office for 6 weeks. First time in history, 25 years, I didn't answer the IC network phones very much. And just tried to heal. And I tried to heal my body, and I tried to heal my spirit. And it's still an ongoing process. Week 1, I was consumed with pain. week 2, I started crying. And I was crying because, I had lost what would nurture a child. And I haven't had children. And I had always wanted to have children. And it's very hard. It's still hard. It's hard to describe. I mean, I'm doing much, much better. And I know it was for the right reason. And I know that videos like this have the potential of helping other people. And I really hope that I can use some of this to prevent some of you from ever going through this. So here's my take-home message. I asked the doctor, I said, why do you think this happened to me? He goes, easy, you took oral estrogen. Well, I took oral estrogen because I wanted to deal with some of the effects of menopause. Specifically, I was having a lot of cramping, muscle cramping. And that's one of the more rare symptoms of menopause. And so I was taking a very, very low dose. We have no history of cancer in my family. None. 0, zip, nothing on both sides. It's astonishing to me that it would be me, the one who would end up getting a hormone-driven cancer. So the first thing you've got to really understand is taking oral estrogen comes with risks. And I really thought it was genetics, and it's really not genetics. It's really just if you have cells that get turned on by by estrogen, and I did. So that's take-home message number 1 is really think about taking oral estrogen critically. I still use a little bit of vaginal estrogen cream just at the entrance to my urethra because that gets very dry and that helps. And we feel that comes with virtually no risk or very, very little risk, whereas the oral estrogen has a lot of risk. So think about that. And then if you see any spotting at all and you're on estrogen, or if you see any unusual spotting, would you please call your doctor, and would you please go in and don't be afraid to have the biopsy. Really, it wasn't that hard. And I was very, very lucky because we caught it before it became active tumors. If I'd waited another 6 months, it could have been a much different story and I could be facing chemo. So anyway, I want to thank everybody who sent me Get Well cards. You were a doll. You have no idea how much that helped me. And we're out the other side, and I'm definitely better, and I'm definitely healing, and it's just a journey. It's quite a journey. So that's my story. And for any other early cancer victims out there, you know that you are not alone. I know that I'm not alone, and let us continue to support each other. I wish you well.